My name is Matthew Langenberg, and I am a vascular surgeon. I joined the Air Force in April 2001. That was before 9/11, and I did it to help with medical school bills. Medical school bills were coming due, and I wasn't really earning enough money to make ends meet. So the Air Force helped me in exchange for serving. In my free time, I serve my children. I have two boys that play hockey. I have a daughter that plays basketball and golf, and my other daughter rides horses. So between all four of those kids, my wife and I are chauffeurs and medics and cheerleaders and whatnot. A vascular surgeon predominantly works on arteries and veins. And we do not work on the chest arteries and veins. In other words, we're mostly peripheral vascular surgeons. So we handle the arms and the legs. We also do work in the neck and the carotid arteries, and we take care of aneurysms in the abdomen. When I was in residency training in Youngstown, Ohio, I was operating and doing a leg bypass while one of the attendings came in and noticed that I was doing a good job. And the attending suggested I consider vascular as a specialty. At the time, I hadn't even thought of it. I thought vascular was overwhelming and the patients were complex, the problems were challenging, and the complications were severe. But after putting some thought into it, I decided to give it a try, and it turns out that I enjoy it very much. Peripheral artery disease is caused by arterial sclerosis and atherosclerosis. Some people call it hardening of the arteries. It's the #1 disease in the world today. It's what causes strokes, amputations, and heart attacks. A lot of time our referrals come from family doctors, but you can also self-refer for things like varicose veins. We aren't really concerned about varicose veins for their looks or cosmetic reasons. We're more concerned if you have issues of pain or swelling, itching, burning, bleeding, ulcers, things like that. One thing I like about Firelands is the sense of community here. And we have fantastic physicians that work here. From my standpoint, the most important things my patients could do is simply walk every day. If people just walked more and didn't smoke, I'd have a lot less patients to see because they wouldn't need me. And that's a good thing. My mom knows I'm a vascular surgeon, obviously, and she tells her friends she likes the fact that I'm a vascular surgeon, but then she whispers to them, you don't want to have to go to him because you don't want the problems that he has to fix.